My name is Renee Christopher Bordley. I have stage 1A breast cancer, invasive ductal carcinoma, specifically in carcinoma in situ. Well, at that time, I didn't know anything. I had to educate myself on alternative therapies and complementary therapies. So because I was not knowledgeable at that time, I just chose the conventional therapies. And that included surgery, which was a lumpectomy with a sentinel node biopsy, followed by a course of radiation, and then hormone blockers, or specifically estrogen blockers, for 5 years because I had an estrogen and progesterone sensitive form of breast cancer. It responded poorly. I just have a very, very sensitive constitution, very sensitive. I have lots of allergies, plant allergies and food allergies and chemical allergies. So the treatments for my body were very harsh. The doctor only removed one lymph node, yet I developed a lymphedema in my right arm, which I still have today. That's a form of inflammation, and it can cause muscle weakness. The doctors were surprised that my body responded that way because I have one of the top surgeons in Maryland. Then the radiation just made me feel sick. I was very sick and exhausted, lethargic. The tamoxifen caused very serious side effects. It caused internal bleeding in my uterus, caused massive fibroids to grow rapidly, polyps, which are precancerous growths. The problem with taking the estrogen blocker tamoxifen is that in some people, it can, while it's blocking estrogen in other parts of the body, it can produce excess estrogen in your uterus, which then puts you at higher risk for developing cervical and ovarian cancer. So in essence, you're trading the risk of developing or having a recurrence of one type of cancer, namely breast cancer, for the risk of developing a different type of cancer, cervical or ovarian cancer. I didn't like those options, but again, at the time, I was experiencing a lot of pressure in the choices that I should make, and the doctors felt that since my cancer was so estrogen sensitive, that it was important for me to take the hormone blocker, so I did it. But it caused all kinds of bleeding, and it caused, the radiation and the estrogen blocker caused problems with my memory, and even my speech was affected. It made me extremely tired. I didn't realize that tamoxifen caused fatigue, it caused hair loss. I could go on, but the side effects were very harsh. Most women, well, I won't say most women, but many women are unable to tolerate this medication. Well, I decided literally the week that I was diagnosed with cancer that the conventional therapies, I didn't feel that the doctors had a good track record with treating cancer patients and keeping them alive with a good quality of life long term. So I decided that I would look into complementary and alternative therapies because quality of life was very important to me, not just longevity. I wanted to be a thriving cancer survivor. I have a young child. At the time, she was 5 when I was diagnosed, and I wanted her to have a life and a mother who was very vibrant, not debilitated by her cancer therapies. So there was a cancer support house near the hospital that I attended, and I went there, and there was a woman teaching Qigong. It was not medical Qigong, but it resonated with me. I couldn't believe it. I just looked at her and I said, "What is this?" And she said, "It's called Qi." And I said, "I've never experienced anything like this. It's like moving meditation." And I said, "I don't know what this is, but I'll be doing it for the rest of my life." So I went home, and I did some research online, and that's when I discovered that there was a different type of Qigong called Medical Qigong. And that's what I knew that my body needed. And so when I did further research, I discovered that there was a person right here in Baltimore that specialized in that, and I was very excited. So I sought out Dr. Chen, and I started the Medical Qigong immediately. And I did that for a few years, and what I noticed is that I immediately started to feel better. He taught us very basic things like organ massage and gathering qi so that I would have more energy, and that at the time I was having joint pain and other issues, pain associated with my my cancer therapies, my surgery, et cetera. And so the things like the organ massage and some of the other exercises he taught us were very helpful in managing the pain and the other side effects of the cancer therapies, the conventional cancer therapies. So I did that for at least about 3 years. I was coming to class regularly on Wednesdays, and then I would go home and I would practice in my family room. And it really helped not just myself, but my family mentally. My husband was deeply saddened by my diagnosis. I would say that even he was depressed by it. And when I started practicing the medical Qigong, both he and my daughter, it was very uplifting for them. So people should realize that when you are able to find therapies that are good for your body and make you stronger and more energized, it doesn't just affect you, it affects the people around you. So Dr. Chen offers an annual retreat specifically for cancer patients, and I attended last year, and it just changed my life. It changed my life. It had the Golden Walking, which I love. It is very effective. It helps very much. I have problems with my lymphatic fluid, and that Golden Walking, and I'm sorry if I'm mispronouncing it, but it helps with your lymphatic fluid to help keep it flowing. It helps build energy because you're doing preparatory exercises as well that help you gather qi and build energy. And what I noticed is that every 6 months, cancer patients have lab work done. We have blood work done. My blood work started to improve. And the periods where I would, for whatever reason, get caught up with my life and not practice my Qigong as often as I should, or discontinue practicing it for a temporary period of time, I would become lethargic because I was still also on my estrogen blocker. I would have less energy, and problems would start to show up in my blood work. Like I would have elevated blood sugar level, for example, and just some of my other blood markers would not be as good. Then if I start up with my medical Qigong practice again, they would improve. So the reason why I attribute the success to the Qigong is because there was nothing else I was changing in my life at the time that would explain the improvement in my blood work and my lab work. My diet was pretty much the same, which my diet is very clean. I'm very careful about what I eat. But that Qigong, I started to realize that even though it's very subtle, there are a lot of benefits from it, and you have to do it. The more you do it and the longer you do it, the greater the benefits. I noticed the changes immediately, but I wasn't paying attention to my lab work at that time. I just noticed that I immediately had less pain, and then I had more energy, and I felt calmer. I had a lot of fear. I haven't really talked about that. The fear that comes with a cancer diagnosis, even an early stage cancer diagnosis, it can be terrifying. I couldn't sleep. Even though I was only stage 1A, I couldn't sleep. I would lay in bed at night staring at the ceiling and just, I was in a state of panic all the time. Like I couldn't sleep, and I couldn't sleep during the day or during the night. Dr. Chen taught us different breathing exercises and counting breath. And for the first time, I could actually sleep through the night. Counting breath is very effective. In fact, my husband ran into some political challenges at work where some of the people that he was working with he was becoming very angry by some of the political dynamics. I taught him counting breath. And he doesn't believe in these things. I taught him counting breath, and I said, just try it. Just try it, honey. Before you react to anyone at work, just try it. He called me from his office and said, I don't know, I don't understand it, but I did the counting breath. I actually followed your suggestion. And he said, I felt calmer, and I was able to respond rationally. And he said, it's been very helpful. He still does it. He said, it's very helpful at work. So there are different ways to do it. But the way that I practice it is you breathe in for 4, you pause, and then you exhale for 3, for a count of 3. That counts as 1 full breath. You breathe in again, 2, 3, 4. You pause for a couple of seconds, and then you exhale. That's the second breath. And Dr. Chen said to just do this and try to count to 12, get up to 12 breaths. He said, you'd be amazed. Most people can't do this. He said, many of the medical students here at University of Maryland can't do it. And he's right, like your mind, because the whole idea is to do it and not have your mind wander. Just focus, all you're doing is focusing on the breath. And there's something about focusing on the breath with counting specifically, because I had tried just straight mindfulness breathing exercises and they were not as effective. But that counting in, pausing, and then counting on the exhale, and that's one breath, it's amazing. No matter what is going on in your life, it will work. It is the breathing. I absolutely agree. Counting sheep never worked for me, but it helps taking in all that oxygen and then focusing on the breath. It really helps with anxiety. I just cannot emphasize enough how helpful it is with anxiety or anger. Maybe you're angry, like if a person's angry about their diagnosis or whatever frustration or challenge that you're facing, that counting breath method is essential.
So how long and how often do you practice medical Qigong each day?
Let's see. When I'm really good about it, I would say easily 3 hours without any problems. I've gone as high as 4 hours daily. This was after the cancer retreat, though, because he teaches a very specific protocol for cancer patients. And in order to reap the benefits, you really need to practice daily. And the more you practice, you need to practice a minimum of 90 minutes. The more you practice, the better, the greater the benefits. So I would try to do 3 to 4 hours a day because fortunately I'm a stay-at-home mom. So I have the time to do it while my daughter is at school and my husband's at work. And even sometimes I'll do it when they're at home and they love the golden walking, and my daughter will follow me around the house and do it with me. And that's when I really feel my best. If I'm having other challenges, like I have an elderly father that I care for, and sometimes I don't always have a block of 3 or 4 hours a day to practice. So I will try to make sure I do at least 90 minutes to 2 hours. I usually like to do a minimum of 2 hours. That includes my meditation, which is also important.
Since your first diagnosis and the treatment, and how long has it been, and how do you feel after you started medical Qigong journey?
So I was diagnosed 5 years ago. Last month, March 13th, I hit my 5-year mark, which is wonderful. That means you're free of any recurrences, and the doctors can't find any cancer. So I was declared officially, my status changed from a recovering cancer patient to that of a survivor. And I feel great. This is the best I've ever felt in my life. But the Qigong is a very important part. I don't feel as well when I don't practice the Qigong, that's for sure. It makes a huge difference in my outlook on life. It's more positive when I practice. My lab work is better, as I mentioned. Also, physically, I'm stronger because, again, it involves lots of oxygenation of your cells. So that's just so healthy for your body. I feel stronger, and I can do more when I practice the Qigong physically in terms of other forms of exercise, like Pilates, for example. When I do Pilates and Qigong, I feel very strong. So I should mention that a part of my Qigong practice includes fasting. So if I have, it's Chinese water fasting specifically, which is incredibly powerful. So when I find that I'm facing medical challenges and my normal medical Qigong practice isn't quite helping to manage the condition and I need a deeper level of practice, I will fast. And it just helps so much in terms of addressing chronic illness symptoms and helping your body to restore balance so that it functions properly. So because I'm fasting now, I am doing Qigong several hours a day. I do different exercises, though. Of course, you do fasting exercises, but in order to have a successful water fast, you have to do the exercises. So, and you have to do them, I do them hourly. Every 1 to 2 hours, I'm doing some sort of Qigong related activity, whether it's gathering Qi or gobbling Qi, as Dr. Chin calls it, where you're eating Qi, you're taking in Qi from nature, you're taking it into your body and you're digesting it. Or if I'm just doing the fasting, there are actually physical exercises that you do to help with hunger.
So what would you tell a patient who has just been diagnosed with breast cancer? What advice would you give them?
The advice that I would give to them is to seek out a highly skilled medical Qigong practitioner because your life will absolutely change for the better. But as Dr. Chen said, it only changes if you do the exercises. So you want to make sure that you commit to the program. And I have no doubt that you will not only feel better physically, mentally, and spiritually, because Qigong is very spiritual. I didn't really talk too much about that, but it's very spiritually grounding. And when you're facing a life-threatening illness, you do need some sort of spiritual grounding practice. But so not only will those areas improve, but your lab work will be better. Physically, you will be stronger. Your immune system will be stronger, which will help fight any additional stray cancer cells that might be circulating throughout your body.